Much has been made lately of the $11.9 million that SelectCare will be paying to its subscribers on August 1st. $8.2 million of that is going to GovGuam and individual GovGuam employees. The rebate required under Obamacare, which limits administrative costs like office expenses and salaries and management bonuses to just 15% of the total premiums you pay into the company. 85% for large group plans like SelectCare must go towards covering member medical expenses. That requirement is just 80% for smaller insurance plans. Calvo SelectCare Administrator Frank Campillo has previously explained to PNC News that the large rebates being paid out back to their subscribers are the result of a conservative strategy initially adopted by the company in the face of the uncertainty of Obamacare's impact. Governor Calvo, who has been criticized by members of the legislature because of his family connection to SelectCare, echoes Campillo's explanation.
The amount of the rebates, and not just Calvo SelectCare rebate, $15 million total for all the insurers, is evidence of excessive overcharging.
No, now there is no one can predict how much claims you're going to have moving forward over a year, unless you're Nostradamus. And I think Vice Speaker tried to be Nostradamus. The bottom line is it was an Obamacare initiative, now setting certain loss ratios. And you're in business, whether it's K57 or KWM or PDN. This is the first year for this type of initiative.
However, not all island insurers are paying out rebates. While SelectCare is returning $11.9 million in premiums to its subscribers, NetCare is not required to pay back any rebate. As Administrator Jerry Crisostomo explains, they examined the requirements of Obamacare and priced their plans and premiums accordingly.
We feel that we priced the plans where they had to be.
So it's possible to do it without having to.
It's absolutely, it's possible to do it. Unfortunately, we wish we had given rebates back to consumers, to our policyholders, because that's always it's not a bad thing. It's actually a good thing if you're able to control costs more.
But it does mean that you did not overcharge premiums.
We did not overcharge premiums. We priced it where it had to be based on our experience in the last, say, 2-3 years. We looked ahead.
However, TakeCare is a different story. TakeCare will not be paying anything back to its subscribers. Instead, the company is awarding more than $15 million to its shareholders. According to the annual 2011 audited financial results of TakeCare Insurance, a public document on file at Rev and Tax, TakeCare, despite having liabilities of $19.7 million, including $11.3 million in unpaid claims, has chosen to pay itself, its shareholders, $15 million. Company officers Joseph Huslin, June Mayer, Lucio Almira, George Chu, Jerry Tan, and David M. Sablan.
I can't speak for what TakeCare, their strategy in meeting the loss ratios and not giving monies back. I would assume that they, because they're an HMO, have a little bit more flexibility. They own a clinic, so there's some flexibility there to engage some different business strategies.
It's called capitation, which allows an insurer to shift administrative costs to subcontracted medical groups like clinics and count that as medical services.
The clinic, the hospital, or the physician group can deliver X number of services for X number of individuals, whether they use those services or not. So if they don't use it as much, then the leftover could be considered a profit.
Doesn't have to be paid back.
Doesn't have to be paid back, right? If they go over that, obviously they will lose money on that. So
critics have called that a loophole.
It is a loophole.
We contacted TakeCare for comment on the $15 million they are paying their shareholders. No comment had been provided to us as of news time. Kevin Kerrigan, PNC News.